has been different. Every session has been different, and that's because each group is different. We definitely encourage folks to jump in with questions, jump in with comments, because that's what helps shape this training and make it your own. So thanks everyone for joining us. The idea for this project came about when Paul Davis and I were going to Capitol Hill after Trump was elected, and kept getting, I think, we were getting the same head nods and the same, yeah, sure, we'll take it to Senator McCain, or take it to Senator Murkowski, or take it to Senator Schumer, or whoever else, about the Affordable Care Act. And then we stopped and said, you know what, nothing's going to happen until people are hearing from their constituents, until they think that this is about job security. So we put out an open call to folks and said, if you want us to come to your town and train members of your community to go and confront their elected officials about the Affordable Care Act, or about improving healthcare in the United States, because the Affordable Care Act is flawed. I think we can all agree and admit on that it's not perfect, but it's better than nothing. And taking a step forward would be much more productive than just getting rid of it. And so that message is being delivered, I think, kind of forcefully to some of our elected officials since we started doing this, and some are just running scared, which I think is great. So first of all, Terry, is my audio okay? Everything all right? Okay, great. And the other thing I wanna say that I picked a much more light-filled room than my attic, until my toddler, who decided not to take a nap today, finally took a nap in the hallway downstairs. So there's no other place than the attic that I could set up to do the presentation without waking up the toddler. So with that, I'm just going to kind of launch in to the training. So first, I think it's really important for us to define what bird dogging is. I remember when I first got involved with AIDS activism. It was when I was initiated to the tactic and to definition. And I think Terry picked out a great definition for us. Basically, that bird dogging is a strategy used by activists who seek out elected officials, pin them down with specific questions or information, and retrieve their views. Right. So I think that it's also a metaphor. If you think about, especially Terry, you're from the South, so you probably have heard this in anybody who's from hunting country, as I am from Oklahoma. You know that if you're going to go bird hunting, you need a bird dog. You need a bird dog to jump into the bushes and scare the birds out, so that you can get a better picture of what you're dealing with. And so you make your target, you expose your target. That's basically, I think, the best way to put it, is that a bird dog exposes your target. And I think the best thing that folks across the nation can do right now is challenge elected officials in a way that forces them to come out publicly, make a statement, and that gives us a chance to hold that elected official accountable. So I'm going to tell a few stories about bird dogging that I think are really, really important. One, when Al Gore was running for president, back in the 90s, and he made his first appearance in his hometown of Carthage, Tennessee. Because if you're running for president, the first thing that you do is announcing your hometown. So a group of 8 activists got on a phone call shortly before he was going to announce his intentions to run for president, and said, look, Al Gore holds a key position in negotiating drug prices for South Africa, specifically HIV and AIDS drugs. So they felt like they were going to use this opportunity to get at Al Gore and make sure that he took a better position, because at that point in time, I think the cost per patient for someone living with HIV or AIDS in South Africa was about $10,000. And it was mainly because the United States was leading basically a gang of Western nations that were punishing Nelson Mandela of South Africa. And they were saying, you can't buy a generic drug. You have to do this, you have to do this, you have to do this. And it was costing South Africa a lot of money to treat patients and making treatment inaccessible. So this group of 8 activists got on a conference call and then drove down from New York to Carthage, Tennessee. It's a small location. I think it was in a library. And they, because a lot of them were young and good looking, I guess, they decided to seat the security and people who were putting the event on decided to put the people who were on the conference call who had decided to have a protest right behind Al Gore as he was about to announce. So as soon as Al Gore opens his mouth, these protesters stand up and start chanting and disrupt the event. The very next day, Al Gore had decided to have his second campaign event in Manchester, New Hampshire, much different city, much different Manchester. And those same kids drove up to Manchester overnight and did the exact same thing. The best part is that Donna Brazil, who is running Al Gore's campaign, comes running after them after they get thrown out of the second event, and she says, "Who in the hell are you, and how many of there? How many are you?" She says, "Who are you, and how many are you?" And Paul Davis, who was going to give the training, except he's actually doing a training right now in Boston, said, "There are 8 of us." And that was the truth. There were only 8 of them. But the idea is that they knew that they could just continue to follow Al Gore around until he gave in, because this public shaming was going to turn the tide eventually, and it did. Al Gore then worked with the Senate and Bernie Sanders and a couple of other folks to change the way to change the price point for South Africans who were on HIV meds. And the price point per patient came for a year, went down from about $10,000 to $350, which I think is absolutely amazing. So, a group of folks got together, 8 people basically did 2 events or 3 events, and got Al Gore to do something that was really amazing. I think another story that kind of builds on that is PEPFAR, or the reauthorization of PEPFAR. PEPFAR stands for President's Emergency. I've never done international AIDS work and cannot even tell you what PEPFAR stands for. I remember.
Emergency Plan for AIDS Relief.
AIDS Relief. Thank you, Benjamin. I just remembered it, but Benjamin, you never forget. So basically, the reauthorization of this plan that was started by George W. Bush just kept, one, bird doggers were following elected officials around, never stopped doing it, pushed Bush the younger to start this plan. It wasn't necessarily that HIV and AIDS was something that he cared about a lot. It was that, he was backed into a corner and then convinced that it was a way for him to kind of redeem his compassionate conservative moniker. And there were a number of different ways that they got John Kerry and other people who were running for president in 2004 and 2008 to really, basically in 2004, to really up the ante. They got George Bush to commit to something, and then to a certain amount of money. I think it was $30 million or $1 billion. The number escapes me. Ben, do you remember if it was 30 million or 30 billion?
I'm sure it was in the billions.
Yeah. Okay. So 30 billion sounds better. I a lot of times deal with New York State stuff, and million sounds like a lot of money to me. Anyway, but basically, $30 billion is what George W. Bush committed to. they had gotten John Kerry to commit to $50 billion, or at least signal through his staff that he was open to it. So John Kerry is holding this campaign event. Maybe 15 or 16 people get near the front of the stage and start chanting, 50 billion for PEPFAR, 50 billion for PEPFAR. And John Kerry, in the middle of the speech, kind of stops and says, "Hey, these guys are talking about something that I really care a lot about. The president's emergency plan for AIDS relief is being reauthorized. $50 billion sounds like a great amount of money." And they just basically, with this one event, had gotten him to come out publicly, even though he had signaled earlier that he was open to it, the $50 billion. And that kind of, even before the election happened, that kind of became a done deal. So $50 billion is a lot of money, especially when you're talking about the price points that we're talking about. Right now, I think people who have been following some of the news have seen the headlines that some opponents of the Affordable Care Act and opponents of expanding healthcare in the United States, especially at the Senate level, the U.S. Senate, have said things like they fear for their safety at town halls. And that's because there have been a number of people showing up at town halls, really holding these elected officials' feet to the fire, making sure they answer tough questions about what they plan to do with the Affordable Care Act. And now, I think that this has shifted the public dialogue from talking about repeal and replace. That was the thing that Donald Trump kept saying on the campaign trail, is that he would repeal and replace. Now the Republicans, if you talk to them on the Hill or if you hear them on television, are saying that they're going to repair the Affordable Care Act. I think that's something. I think that's showing that that some of these folks who are running from their constituents, I think that we're having a positive impact. But I did also want to open it up. Before I do that, I wanted to tell a story about a campaign that I actually worked on personally. The other two, the Al Gore story and the PEPFAR story, are stories that our other two presenters love to tell. The 30% rent cap campaign was a very local campaign. It was an interesting deal where about 10,000 people living with HIV or people with an AIDS diagnosis living in New York City had rental assistance, but they had no affordable housing protection. So basically, these folks were on a rental assistance program that if they wound up getting any supplemental income, so an SSD check, a part-time job, veterans benefits, that kind of thing, that they would have to spend down to keep their apartment. So basically the way that it worked is that if you had no income, the HIV and AIDS Service Administration in New York City, is what it was called, HASA, would pay all of your rent, right? And then you got regular public assistance benefits. Now, if you were someone who we had one campaign leader who ran a business for 35 years. We had one campaign leader who had worked, worked and saved up for retirement. We actually have one campaign leader who won an Emmy because for his artwork and for his visual design. Well, all these folks were stuck in a conundrum to where they would have to spend sometimes 85% or 90% of their income on rent and wind up only getting a couple of dollars in help from the government. And those folks, because they had that extra money, a lot of times would do other things that weren't being taken care of by the city, which is pay for food or pay for more transportation, because the city didn't always cover that stuff. They would wind up paying other bills that the city didn't pay, and would wind up losing their apartment. In this group, there were about there's about a 25% eviction rate per year. So very unstably housed group of folks. A lot of those folks would wind up dying. As a matter of fact, a disproportionate amount of those folks would wind up with undue stress, and then sometimes as a result of that and other health problems would wind up dying what I think were preventable and untimely deaths. As a matter of fact, one of our campaign leaders early on in the campaign passed away the day that we were supposed to go to Albany. And it was because she was having to run herself ragged to figure out ways to stay in her apartment. We actually lost a number of campaign leaders before we could get the bill passed. The great thing about this story is that it's super complicated when you talk about what needs to get fixed. What needed to get fixed is these folks needed a 30% cap on their rental contribution, right? So instead of paying 85% of their income towards rent, pay 30% of their income towards rent. When I first moved to New York and started working on this, the thing that I kept hearing from allies, including one of the bill sponsors' chief of staff, was, this is not going anywhere. I don't know why you're working on it. It's not going anywhere. And the bill had never moved. But because I think we're past the statute of limitations, so I can tell all the secrets. Because we got on the governor's press list and knew exactly where he was going to be every single day, and we knew the press would be there as well. Every single day for a while, we challenged him. Over and over again, and in person and publicly. And then when he would pass the buck on to somebody else, we would push that guy too. So within 6 months, this bill went from something that was done on arrival, something that nobody was really interested in because it was so complicated and so wonky, but we knew had very dire consequences. This bill went from not going anywhere to being the first bill passed in the New York State Assembly in 2010. The really, really amazing thing is that Governor Patterson at the time had probably never really had any intention of signing it, but because we worked so hard, we got the bill to his desk. We had also gotten him to promise us in a church that he would sign the bill if it got to his desk. And then when he vetoed the bill, we really just, because again, we had his press list, we're on his press list. We just went everywhere and just beat him up publicly over and over again. So much to the point that when a new mayor and a new governor were elected, they very quickly put a deal in place to cap this population's rent at 30% of their income. And we used to call that campaign the impossible dream, because we had so many people told us that it was impossible and would never happen. And then the other thing is that we had one of our campaign leaders, who's no longer with us, sadly, who had an amazingly beautiful singing voice, and at rallies would sing Don Quixote or from Man of La Mancha, the Impossible Dream, and it would move everybody to tears. And including the two of the people who told me that it was impossible. I remember them crying outside of a rally in front of the governor's office as our friend James Dean belted out his solo. So bird dogging can be very, very powerful, and that when you deliver the stories of constituents in a humanizing way and hold elected officials' feet to the fire, the elected official has no choice but to do their job. So, Terry, before I ask this question, I wanted to just a technical issue. If I'm getting pop-ups on the screen about chats, should I click that and answer the question, or are you getting those as well?
For some reason, I'm not getting them, but we'll hold questions till the end, and then we'll go through all of them.
Okay.
And I think what Jaron's referring to are the two chats you sent Terry.
Oh,
So he
okay.
just hasn't read them yet. So maybe if Terry, if some questions do pop up, if you could maybe point them out and read them to Jaron. So
Yes.
Yeah, and I'm totally okay with us taking questions during this portion as well.
great.
Okay.
And just a reminder to everyone, everyone's on mute. So if you have a question to speak up, you just need to click the audio on button on the right hand side of your screen or on your phone and then speak up.
All right. So, one of the things that I like to ask during this training is we've just heard stories and we know that this is enormously powerful. We've heard stories about how 8 people got the ball rolling on changing the price point of drugs in South Africa, and got about 18 million people on treatment. Eventually, got 18 million people on treatment that otherwise would not have been. Of course, it wasn't just those 8 people, but they kind of started the ball rolling. The 30% rent cap was about 5 of us that got the bill to the governor's desk and ran a beautiful campaign back in 2010 that just took it from being something that was impossible and a fact of life for people living with AIDS in New York City to or low income people living with AIDS in New York City to being only a matter of time before that dream became a reality. And we're seeing even today that elected officials are running scared from their constituents. But the question I have for folks, and I would love for people to just kind of say why this is, but if this is so effective, what stops us from challenging elected officials all the time?
I mean, I think for a lot of people, they may be scared to do it. They feel that there may be some risk, that, some harm might come to them in terms of being kind of put on a list. They're a troublemaker. Don't ever talk to them. If they ever try to call the office to set up an appointment, don't give them one. So I think there may be some fear that there might be some retribution.
Right, and especially retribution is especially easy if you're by yourself. If they isolate you, if they say Terry Wilder is a troublemaker, nobody talk to her. Right? That's a real fear. What are some of the other fears that we have?
I think for me, it's a real issue of being able to think and get the words out and listen all at the same time.
Yeah, that is another real fear. I mean, you're talking to someone who's an elected official and in some cases a senator, or I know in some bird dogging stories, the president of the United States. You're talking to someone with an immense amount of power, and you are a public citizen. You don't even have a public life. You're a private citizen, and that's it. There's a huge power differential. So trying to stare that down and also formulate a question all at once can be kind of daunting and kind of impossible, if you ask me. What else? Let's get one more fear that we all have.
Well, this is Lily. I think some of it is personality and also culture. I'm Asian American, and so I've been brought up as a child to not really question authority. But
Yeah.
fortunately, I went to high school and college and had professors that really pushed me, and bosses that pushed me to keep asking questions. So I've developed that over time.
Yeah, I think a lot of people, and I actually think it's something that is very quote unquote American, is that there is a time and place for you to speak, and a time and place for you not to speak. And sometimes when someone who is so powerful, like a politician, is speaking, you don't feel as though you have permission to do that. That's and sometimes saying, getting really aggressive with someone you don't know can be sort of uncomfortable. So I think all of those are things that we hear quite frequently because I think they're common. And I will tell you this, that as someone who has done a lot of bird dogging, who's been put in a lot of situations where after we had made our plan and after we had done all the preparation right before we were going to do something, I was absolutely terrified. I think probably the craziest, the most awesome thing that I did, other than for the 30% rent cap bill. Yeah, okay, statute of limitations are up, so I'll talk openly about this. This is, by the way, this is not something that we'll ask any of you to do. But I used to do some really crazy things for some campaigns, because it was it was either this or the people that I knew in New York City that I just, this place that I just moved to, my friends were going to live on the brink of homelessness. So I took it upon myself to do whatever it was that I needed to do. So the day we got on the governor's press list, I think back in 2009, the next day we knew he was going to have a press conference on the 39th floor of his office on 41st Street and 3rd Avenue. So I put together an elaborate scheme that got all of us into his press conference on the 39th floor with protest signs, and we disrupted his press conference about and called him out for cutting the AIDS budget. The best part is, after we got thrown out of the press conference, someone who worked for NPR would say, "Wait a minute, you guys got into this press conference? I couldn't even get into this press conference." And as a matter of fact, because of that wonderful direct action, now things are very different between the governor and the press. You have to have a press badge to get into the governor's press conference. There's a lot of other things you have to do. But boy, was I was super duper nervous before that. Another really crazy thing, I got arrested once for disrupting Congress. That was my official charge, where I snuck 30 people into the House of Representatives with a 30-foot banner to protest the sequestration. And the plan was that I was going to grab the banner and we were going to spread it out across several rows in the gallery, and we were going to start chanting. We knew our chant. I was so nervous that I jumped up and disrupted Congress and then forgot the chant, but then remembered immediately, just because we had practiced so much, what the chant was. So, and again, those, what the purpose of this training is not to put people in arrestable situations, but I tell those stories just to let people know that this stuff is not easy. People who have done, even though I've done things like getting arrested for disrupting Congress, still, whenever I'm supposed to raise my hand and challenge an elected official, I have butterflies. So people who've done this a lot still get butterflies. Some people don't, and that is the rare exception. So I think all those things are important to note, and I think that we should all remember that this is extremely difficult work. So we're going to get back to addressing some of those fears and make it a little bit easier. But I think that right now we should talk about just quickly, and Terry went over a lot of this at the beginning of the presentation, what we're fighting for. And there are some specific fixes that we want to see to healthcare in the United States. I think first and foremost is that we want no Medicaid or Medicare block grants. And just to explain that very quickly and easily, Medicaid is an entitlement right now, which is to say that in every state, the way Medicaid is supposed to work is that if you're eligible for Medicaid, you show up at a social services office and you apply, and they put you on Medicaid. And then the state just tells the federal government, well, we have this many people eligible for Medicaid that have applied for it. This is, and that we're carrying. So this is how much money we need. It's an entitlement. Block grants would change that to where instead of it being an entitlement, it would be basically one of the easier ways of saying is that you just get a set amount of money. If you're in New York State, you get a set chunk of money. Maybe they calculate that per capita, people living in the state or people who might be Medicaid eligible. But once you run out of that money, that's it. States really don't like that. And as a matter of fact, there are a lot of Republican governors who are openly voicing the fact that they don't like that. So number one, no Medicaid or Medicare block grants. Number two, we want more people covered with fewer out-of-pocket expenses. If you're talking about changing the Affordable Care Act and fewer people are covered and there are more out-of-pocket expenses, that's not it. That's not what we're talking about. Number three, I think, is for me and my work, and I think for folks in the ME community as well, probably one of the more important ones is no discrimination against people with pre-existing conditions. Two things that I want to say here with that. One is that some opponents of the Affordable Care Act, or some people who before the election were saying that they wanted to repeal and replace the Affordable Care Act, are now saying that, there are two things that we're going to do when we replace the Affordable Care Act or repair it. One of those things is make sure that you can stay on your parents' insurance until you're 26 years old. And that the other thing is that we won't discriminate against people with pre-existing conditions. And in fact, we're introducing this this principle called continuous coverage to make sure that doesn't happen. Well, I just want to point out that continuous coverage is basically this idea of continuous coverage that some marker bills that have been introduced have say that if you have a pre-existing condition, you can't be discriminated against if you maintain continuous coverage. So if you're covered, and then for whatever reason, and there are a lot of reasons why someone might be not covered suddenly, at any time, for any amount of time, that someone can discriminate against you. So that's not a protection against discrimination. The other thing is that Paul Ryan and Mitch McConnell, I think last week on MSNBC, were saying that they were going to leave discrimination against people with pre-existing conditions up to the states, which is a no-go. It should not matter what state you live in. No one should be discriminated against because they are living with a pre-existing condition. And I think the fourth broad category is that some opponents of the Affordable Care Act, or people that want to take a hatchet to it, are saying that what we could do is like have a quote unquote default plan for people, and they were thinking that this default plan would have minimal coverage. Well, I think that a default plan is okay as long as it is as good as what members of Congress get. If that's a default plan, that works. If someone isn't being contacted by the federal government in an effective way, and they just are auto randomly assigned, and it's as good as what Senator McCain gets, that's fine with me. Are there people who are queued up that wanted to contribute or have questions? Okay.
I have a comment.
Yes.
I have
Sure.
a comment. Yeah, so this is Lily again, and I have experience working in the healthcare industry and with insurance. And one thing is, for discrimination, I just wanted to point out that when they say pre-existing conditions, it can be even things as slight as acne. Even little tiny things, they can discriminate you based on it. And you can't cheat when you fill out these forms, because all the medical insurance companies have a database called the Medical Insurance MIB that they share amongst themselves. So they can see exactly what your history is, even if you don't fill it in with a form. And then the other thing that has been brought up, I think, is like caps on care during like an annually or in a lifetime. And the problem with that is if you have cancer, it can amount to millions of dollars. So that's also a concern.
Yeah, thanks for pointing that stuff out. I think that that there are a number of things that when we talk about more out-of-pocket expenses, that that gets brought up, but I think for this presentation is very important to note that a coverage cap or that kind of expense cap would be devastating and make healthcare inaccessible for our communities. And absolutely, it is impossible to lie or sometimes even to correct information that's in the database. For example, I smoked for a month when I was 20 years old. I told a healthcare provider that I was like, well, I only smoke when I drink, and I quit drinking in 2002. So, and I smoked for a month, and maybe a cigarette a day. That was it at the most. But a lot of times when I'm dealing with a healthcare provider, especially when I moved around a lot, they're like, "Oh, you're a smoker and you have asthma." And I was like, "No, I'm not a smoker. I smoked for about a month, a couple of cigarettes a week, not a smoker." But this stuff follows you around, and pre-existing conditions are anything that they think of as chronic, whether it's chronic acne, asthma, or anything, they're gonna use. Basically, I think that some people who are opponents of healthcare just want to find reasons to not cover people. There was another question or comment.
Yeah, I am interested in the idea about let's see, the continuous coverage.
Yeah.
Because my understanding was you can't force people to buy into the programs. And so if it has to be a voluntary buy-in, then one of the ways they were going to encourage that buy-in was continuous coverage.
Mm-hmm.
So if you get rid of that requirement, how do you get the people that aren't sick right now to buy in?
Well, I think that there's a way to do it, to stop discrimination against people with chronic conditions without saying that, well, now you can be discriminated against. Because the other thing with continuous coverage is a lapse in coverage. So if I'm a low-income person living with HIV in New York City and lose my housing and fall out of care, and a month later I get back into care, I think that's really the problem. I think there's another way to incentivize people to enroll in a plan without saying, if you don't, we can discriminate against you later.
Okay, so the continuous coverage, this is only dealing with people with chronic health care and not across the board for everybody.
Well, so there are some across. I think that the way that some folks are talking about continuous coverage is saying, well, look, we're using this tool as an incentive to encourage people to enroll in care. But there's a way to do that. There's a way to, an incentive could be part carrot for the horse or for the mule and part stick. I think the stick kind of outweighs the carrot here. Because I think it can be used as a tool to kick people with chronic conditions off of healthcare once they fall out of care. Was there another question or comment?
Timber had a question.
Hi, Jaron. This is Joe from Virginia. On the subject of fear, I fear bird dogging because I fear myself. When I've confronted officials in the past and they've lied and I've called them on it and they double down on their lies, there must be something wrong with me because I take that personally and become too furious to think or act rationally.
I do the same thing. The same thing, which is why I think that's actually a great segue, Joe, into the next slide. Ben, did you say that someone else had a comment? And then Joe, we're gonna get back to that portion in a minute. Nope. Okay.
I think we can go on.
Great. So that is a great segue, Joe, from Virginia, into how to conquer some of those fears that were named. I think, the one that you just named was you get pretty upset when someone lies to your face. I do too. I think that's a good thing. But I also think that as long as you've got a specific plan and you remember to stick to the plan, that you can channel that in a productive way. I think other things that we talked about were how we're worried about being singled out or there being negative repercussions. I think you know, one of the great things about the story of Al Gore running for president is that basically for 3 straight days, the exact same 8 people somehow kept getting seated behind Al Gore for his televised appearances, which is to say that yeah, they they may hold it against you. I mean, we beat up the governor of New York for an entire year. And at one point, I remember we were talking with Patrick Gaspard, who was then the political director for the White House. And he had just gotten off the phone with the governor and said, Jaron, you better watch out because I think he's going to offer you a job. And I was like, why is this guy going to offer me a job? I've been like hounding him every day. And sure enough, after threatening him again at a public appearance, the governor said, look, I don't know what you're doing after this, but I could use someone like you. So it and I know plenty of people who have bird dogged and they got attention the right way. So these fears are real, but I think that there are ways to kind of work through them, and there are kind of 4 easy steps, or not easy, 4 I think ironclad things that you need to do in order to bird dog successfully. I think number 1 is you have to make a specific plan, and you've really got to think it out. One thing that we definitely discourage is we encourage people to go in a group and never go alone. If you feel like you want to go alone or are more comfortable going alone, by all means, do what you think you need to do to get the job done. But we find that it's a lot easier for folks to do things when that we I just saw a chat thing that came up, and I think that one of the fears or one of the concerns for this is that most politicians or a lot of people in public don't know what ME is. And as a matter of fact, through this process, I've been educated way more than I know way more now. I still have a lot more to find out about ME, but I know way more now than I did 3 weeks ago. But we'll that kind of rolls into one of the other bullet points on this slide. But again, making a specific plan. This means 1, getting a group and saying, all right, this set of 8, 10, 20, 40 people, we are going to work together at a specific event. So the other thing that goes into making a specific plan is finding a specific event. Because of the Town Hall Project, we know where a number of federal officials are going to make public appearances, and it's a little bit easier. We've also got a very handy text loop that I'll show you at the end of the presentation that you can actually text, and we will tell you, if you give us your zip code, when and where your elected official is going to meet up. The other thing that goes into making a specific plan is get your question written ahead of time and write it down. Not type it, but write it down. If you type it out, you'll remember it differently than if you wrote it down. So handwrite your question, practice it several times. While we're on the subject of questions, what makes a good question for a forum like this?
One of the things in the article that we posted on ME Action about bird dogging that was adapted from another group.
If you've been feeling gassy or
I
think someone's All right, great. I think Lily just muted. Go ahead.
One of the things that this adapted kind of suggestions for bird dogging mentioned was show the elected official that you know something about them.
Yeah.
So starting your question with, last September, you said that you supported such and such, and then say your question.
Yeah, that is definitely, and we sometimes will even like to compliment them, even if it's like the smallest compliment. Thank you, Senator Amlo. I know that you signed the bill that prevents puppies from being punished so harshly. On that, I'd like to ask you a follow-up question. So basically, Terry, that is 100% right. As at the beginning of the question, show that you know something about them and about their history, and it also doesn't hurt to praise them, even if it was, just the bare minimum for that, because that makes them feel like they're more likely to engage. Anything else on what makes a good question?
I was actually wondering whether a good question was framing it so that it's a yes/no answer, or framing it so they have to speak. And I didn't know which was.
A great question. One thing that I've noticed is that whenever I give a politician an inch, he takes a yard. So if it is an open-ended question, if it's an essay answer, they take it to somewhere way else. The question may have started off. I think a great example of that is I'm sure people on the call on the on the webinar watch Fox News. I've actually appeared several times on Fox News, and the worst thing that they do with me is they never ask me yes or no questions. They give me open-ended questions, and I take them wherever I want. The last time I was on, I was talking about Ben Carson being floated as potential HUD secretary. And instead of talking about the cities or instead of talking about whether Ben Carson was qualified for the position, we wound up talking about AIDS and cost savings for treating people living with HIV and AIDS. That's what the entire conversation was about. And politicians are probably way better than I am at taking and hijacking a question and moving it somewhere else. So you want to ask a yes or no question, but the best way, I think, to ask this yes or no question is to make sure that the answer is in the question. Does someone want to give me an example of that? And it's not easy, actually.
Hi, I'd like to give a stab at it.
Go for it.
Director Collins, when do you plan on funding ME research in a way proportional with its burden?
There you go. The answer is in the question. While, you said when, I think that, that's not a yes or no, but I actually think that that's pretty effective, because you're kind of, that's actually in some ways more effective than sometimes a yes or no question, because you're saying, when are you going to do it? It gets them on record. So there is a sort of exception to the rule. I always feel like the exception proves the rule, though. And actually, one of the great things about a good question is that refer to Terry's first rule of a good question, that you keep your target's history in mind. So if Collins has already answered a yes or no question about funding ME research, then you don't need to ask if you're going to do it again. Now it's when. You said you were going to do it. Now when are you going to do it? In general, yes or no questions are best. But if they've already answered yes or no, I think questions like when, or when can we expect, or what Joe just did are absolutely perfect. So that I think I think people on the call just did a master class on what makes a good question. I've actually never had that during one of these trainings, where every single one of those is perfect and on point.
So, Jaron, I think Courtney may have had a question or a comment.
Go ahead, Courtney.
I was just gonna add, and Joe, both your comments. The question that was brilliant. We had a chance to do this with President Obama in a town hall when he had to run for re-election and he had to win the state of Nevada. And we prepped, and so the stuff about knowing what you're going to say ahead of time, understanding it has to be a minute and a half or 2 minutes at most,
or maybe less, maybe 30 seconds. Less, yeah.
When you ask your question, but also some personal connection or appeal, some personal part of your story.
Right.
We did a number of the things. I didn't know there was a name for this. My husband and I, we have followed around anybody and everybody who could help on this disease for a really long time. And some of it's at scientific meetings, some of it's at really public, like the president town hall. But some of the things you just said really worked. So we managed to get asked on, through a lot of hope and prayer in that town hall meeting. And then we thanked the president for putting science back into the national agenda. So it was quick. And then we had to explain a little bit about what CFS was. But we had our kids there, and it was like a very direct, I need help for my family. Yeah. And it sparked a really, nobody's better at this than President Obama, but a very emotional, and yet, it was an answer we could take.
Yeah.
We had a lot of follow-up to get anything out of the answer. A lot of follow-up.
Yeah.
So I just wanted to add the personal part just has to be short. And that's in our community, it's hard, and the best way to do that is to prep it ahead of time.
Right. I mean, you're 100% right. I think that earlier we talked about humanizing people. It's super important. You've got to do it. You've got to humanize yourself, and sometimes the way to do that is to identify yourself as someone who's directly affected by this issue, and then give a brief snapshot about how this will, how a negative change will mess up your life, or how they have the power to make your life better. So I think all four of those things are probably, I'm just going to look at my notes, for a good question. That those are all great. Yes or no questions. I think the key ingredient is that it's close-ended. That either they say yes or no, they give a specific time or date that they're going to actually do it if they've answered yes already, or whatever. That it's a close-ended question, that they don't have room to take it everywhere, because they're very good at that. The question contains the answer. Definitely don't forget that. If you can bring up a fact or a reference about what the politician has done in the past, and especially if you can thank them for it, that's great. And then finally, it is also good to include a fact or a personal detail that humanizes the issue. Now, I'm not lying to anybody here, but those were the four things that go into our ingredients for a good question. So if anybody has anything to add, this may be something that we change our presentation for, because you all seem to be really on it. Anybody have anything else on questions?
Jaron, I just wonder if you could speak a little bit to, or Courtney, a little bit more about follow-up, and what does it mean to follow up, and what's the best way to follow up with the person you're asking the question?
Actually, Ben, if we can hold that to the last bullet point, because that's all about follow-up. So once you've gotten your question that has those 4 killer ingredients, right? It's a closed-ended question. It's got something about what this elected official's already done. It contains the answer and it humanizes your issue. You've also, if you know that it's not a question or answer session, or you have no shot of getting them to answer a question, then you prepared your chants, your signs, or that you have figured out, well, once he says this, like once when we snuck into the governor's press conference, we got a copy of his of his speech beforehand, and I knew exactly what we wanted to jump up and say right in front of a microphone of a member of the press, to say that cutting the AIDS budget is not smart, because he said something about making a smart cut. Once you've got all that stuff worked out, then you know you're in business. The next thing that you need to do is scout and arrive early. Every single venue is different, and the format's going to be different. You want to get as much information as possible. You want to know if there are going to be microphones positioned for question and answer, that you know where the microphones are, and that you sit around the microphones. If it's going to be something that doesn't require or that doesn't have question and answer, then it might make sense for all of you to sit together, or to be dispersed, but not greatly dispersed, among a section, so that if you're making friends with people, more on that in bullet point number 3, if you're making friends with people, you can actually persuade them to channel along with you, like they did with John Kerry, and there's actually a couple of people who did the Lindsey Graham thing. There are also sometimes it's important to note that if you get close enough, like a friend of mine, Hugh Espy, got close enough to Mitt Romney in Iowa to just shout out, "Do you believe that corporations are people?" And he actually wanted that to be an open-ended question, because Mitt Romney said the famous thing, "Corporations are people, my friends," and it was a horrible thing for him to say, and it followed him on the campaign trail. But Hugh knew that because of the way it was set up, if he was loud enough and got close enough to the stage, that he could just shout out the question and have a chance that Mitt Romney would answer it. So really important to scout, to know where the exits are. If it's a closed venue, if it's indoors, you want to know where the exits are, because if you can station a couple of people there, they can shake hands with the target, with the elected official, and try to get them on record, because that's where the press are going to hang out too. You're going to want to make decisions then and there, or you want to make as many decisions as possible before the event starts, about where people are going to be, where the exits are, what kind of a venue it's going to be, or an event it's going to be, et cetera. And definitely you got to get there early to get good seats. The third bullet point is you got to get noticed. The one thing that I think everybody can do is make eye contact with the elected official, or make eye contact if it's not something where you can actually we're close enough to make eye contact with the elected official. You make eye contact or friends with the people who are manning or staffing the microphones, and with people around you. I think sometimes people, when they're going to public events, they're worried. They're feeling like, oh man, I'm about to do this thing that's going to be looked at as incredibly rude. I might get blacklisted from this person's office. Oh my gosh, everybody sitting around me knows I'm about to do something awful. Oh no. And it just makes it harder for you to ask the question. So if you're doing things like, I know a friend of mine, Paul Davis, likes to cheer wildly whenever they say anything that is less than objectionable, because the politician will then look and say, oh, this guy really cares a lot about library books. Okay, great. This guy likes me. I might call on him for a question because he likes me. By the way, this is really funny. There was an 800-person event that Paul attended. They had 8 people there. There was no question, or there was a short question and answer, and all 8 of the questions that were asked by members of his group, because they were super friendly to the people with microphones. They were cheering. They were having a good time. and they made it look like they belonged. So the staff were like, "Oh, these people are having a good time. We should ask them questions." And a lot of times with these things, there's a ton of nervous energy. I know that I'm just so jittery, I can barely sit still. So when it comes time for question and answer, first thing you do is get your hand up high and fast. It's like it's hardwired or whatever. If you see a hand go up and it just stays up, it's like you have to do something. Lindsey Graham once was at an event, a smaller event, maybe 30 or 40 people, and he actually knew the bird doggers by face, and even commented during his speech, was like, "Oh, it's the AIDS folks. They're here again, blah, blah, blah." And during his speech. And at the end, there was no question and answer, but at the end, Paul shot his hand up, and Lindsey Graham just called on him and even said, geez, why did I do that?" And Paul asked him a question, got him on record saying something. It's just, if you stick your hand up high and fast, sometimes they just can't resist. And then now let's get to the last one, which is about follow-up. Courtney, right? Courtney? Am I getting your name right?
Yep.
Ben just asked a question about follow-up and how the situation with Obama took a ton of follow-up. Can you just expand on that a little bit?
Yeah. So everything in the town hall was videoed. So we immediately had access to that and spread it all over the community. We did a email campaign into the White House to thank him, because he essentially said, "I'll look into it and see if I can get NIH to do more about your disease." It wasn't very specific, but it was what we needed.
Yeah.
It was a promise, exactly. And so we did a lot of work to engage the community and, following up, thanking him for the promise. And then we tried for months to get someone at the White House in the Public Information Office to respond. What are you doing? So we got nowhere on that very specific stuff. And the timing was such that we knew he had to win our county, Reno, in order to win re-election. And we heard he was coming back to town to do another town hall 4 months before the election. And so we wrote a letter to the editor in the Reno Gazette that said, I want my kids to grow up knowing that men keep their promises, and he's coming back to town, and we have nothing. It was we want him to keep this promise. And then I faxed it to the Public Information Office in the White House and emailed copies of it to anybody I could get. And we got a follow-up phone call. And then we had to figure out, what to ask for. So it took a year to actually get follow-up, but it was the biggest thing we could possibly get follow-up on. So it was,
in my experience, just from listening to other people's stories, and that's typically how long it takes. Remember, bird dogging is just scaring a bird out of the bushes so that you can make your target more visible, right? You've actually got to, I hate to say this, especially, I know there's at least one vegan on the call, but the idea with bird hunting is you actually shoot the bird. You still have to do the other work. The other work is just as hard. And that's the rest of it. The rest of it is, and I think Courtney kind of laid it out perfectly. You want a written record of what the elected official said. You write it down. If it was videotaped, try to get a copy of it. And still you want to write it down so that you have something, if possible, verbatim. Then sometimes at this sort of thing, you want to make sure even that people keep asking the same question, that it's not just a one-off, so that even at the same event, I know that there have been several events where this guy gives kind of a crappy answer to the question about healthcare, and then someone says, I was going to ask about education, but I want to hear more about this. You didn't answer his question. And you just keep going. You just keep going until they do something, until they say something. You also want to record that record, whatever they're saying, and get a report out to the rest of your community and the rest of your group, so that Senator so-and-so just said yes to this particular healthcare question. The next question shouldn't be yes or no. It should be when. When are you going to do it? Or why haven't you? You said you were going to do it at a town hall at such and such. The next thing to do, I think, is you also, at the event, if you can shake their hand, if you get close enough to the barricade to shake their hand, that's great. Just do that, because when you shake their hand, try your best not to let go. Andrew Cuomo is bigger and stronger than me, and is a scary guy. But as long as I've got his hand, and I've noticed this over the years, as long as I got his hand, it's a lot harder for him to just say, I'm not answering your question, leave me alone, kind of thing. He now resorts to just kind of bro punching me in the shoulder because he knows that I don't like that, and it's a way for him to stop me from grabbing his hand. All that to say, handshakes are very, very effective. To get in, grab somebody's hand, start talking to them, try to get them on record if you didn't get to ask a question, or if you want to ask a follow-up. Another thing that Courtney mentioned is that you want to run to the press. Keep talking to the press. Send out a letter to the editor. That can be enormously important, especially once you've gotten them on record, because that could be news. You want to make sure that that's happening. And then I think we talked about it a little bit, and what also goes into the follow-up that Courtney mentioned is that you want to keep reporting out to the rest of your community about what just happened. Boy, thanks a lot, Courtney. Any other anything else on this one? And I think we're going to move on to the last side.
Can I just ask a question about kind of the press piece? I'm wondering if you could comment about doing a live stream as you're at the actual event, like a Facebook Live. I'm just wondering if you've had experience with that, or if you can speak to that.
Yeah, that does work. When I first started doing this, I thought that social media was, I was like any other organizer, thought that social media was worthless. And it was, kind of a Luddite in that regard. But you can live stream something. If you can Facebook Live something, that can be a way, especially since you're in a public forum, that it's there. It can be accessible to the press. Sometimes a picture paints 1,000 words. I don't have any personal experience with that, but I do know some people that have been at an event, Facebook Live, and got somebody to commit to something on the record. Then it made it, I remember once I mentioned that we got Governor Patterson. We had cornered him in a church. We did all of our scouting. We knew where he was going to be, when he was going to be there. We had scouted the location. He was at this church. We had all the exits sealed, and we cornered him. And he promised us to sign this bill in this church. Well, there was actually at that point no press actually near where we got the promise. So we then started calling the Associated Press and said, this is what he said verbatim. He said this. We didn't have any video evidence of this, but the Associated Press and a couple of other press outlets started calling the governor's office. They couldn't get him on record, but everybody believed that he said it, right? And it started a couple of dominoes. Now imagine that we had Facebook Live that. Imagine if we had video proof of this guy saying that he was going to do it. It then would become a lot harder for him to then, after promising low-income people living with HIV in a church that he would sign a bill that would help protect their livelihoods, it would be a lot harder for him to veto that bill. So that is an enormously powerful tool, and I can only imagine where some of us would be if we were able to use that. So now we've got about 10 minutes left, and so I'll go to the last slide. Yeah, Is there another question?
Yes. Can you hear me?
Yes.
Okay, thank you so much for doing this, Paul and Terry. I have a question, comment. It's not really well thought out, but as you were speaking, I just wondered if this whole Part D with Medicare, bulk purchasing of prescription drugs from Medicare and Medicaid, and also the reimportation of drugs from Canada. I mean, this whole bill that Bernie Sanders keeps trying to introduce, if this can also, the platform and what you're working on and what we're all going to work on with bird dogging, if those issues can be extended, because we know that in the U.S., prescription drugs are outrageously expensive.
Yeah, I mean, one of the things in order to make this kind of a little bit more wieldy is that we decided that we weren't going to bring up everything. I think with some groups, prescription drugs are more of a hot topic. I didn't know. I decided to go super basic when we're talking about what we're looking for. But in bullet point number 2 that I just pulled back up, more people covered with fewer out-of-pocket expenses. I think that's, I'll just for a minute opine on drug prices. So the latter part of that, fewer out-of-pocket expenses, whenever typically what's happened with healthcare is that the government says your prices are too high, we're going to walk away. Well, if the government walks away and doesn't negotiate a deal, then the patients suffer. Or they say, oh, your prices are too high, so we're going to put it only on a certain on a list so that only certain people can get that drug. Well, again, the patients. So basically, in every situation, it's set up so that in these negotiations, the patients suffer. One of the ideas that we've been peddling on the Hill is the idea that that if the price of a drug is higher than the next 10 reference countries, than 10 other countries that have similar economies and sizes, that you can break the monopoly on that drug and just do generics. That the federal government should have that tool in the toolbox. That they can say, all right, fine, well, we bust your monopoly. And we've actually gotten some Republican support in sliding that in, especially some of them that are saying they're going to negotiate tough deals. So that sometimes can be something, when we're talking about drug prices. After meeting with Senator Sanders during the campaign, that was kind of when we talked about healthcare. That was the only thing that he was focused on, was on drug prices. And I think
it's just so critically important. I'm sure I'm not telling you anything you don't know, but before, at the very beginning of the Affordable Care Act, Big Pharma got in there with their lobbyists and cut their own deal so that they weren't going to take the hit. And Part D has to be legally changed for even bulk purchasing of Medicare and Medicaid. So
absolutely. I think
and that everybody, based on Bernie pushing at campaigns, that this would be changed. And I think the rhetoric is becoming less and less. Anyway, I don't want to hijack this, but I just think that this is critically important.
It is. I think drug pricing is one of the things where we have a lot of potential to really improve healthcare. Those guys totally got away with murder. They totally got off. They got everything in the last go around. And I remember working on the Affordable Care Act in Maine, door knocking in Maine, to target Collins and Snow back in 2008 or 9 or whenever that was. And prescription drug prices were one of the most important issues that people kept bringing up. So I did want to I want to respect time, and I'm sure Mom is I'm sure my partner is ready for me to help out, since I said I would be back taking care of the kid at 4:00 Eastern time. But I wanted to wrap up pretty quickly and just give a couple of things, and then open it up for question and answer as best we can. So one, I mentioned you could get text alerts. You can text the word bird dog, all one word, to 83224 to get text alerts about when your elected official is going to have a public appearance. One thing that we typically do, this is the first webinar we've done, is we set up an email group because we have an email sign-in list that goes around. Terry, if you're interested in doing that, I think that people could do that because, step one of effective bird dogging is making a specific plan and organizing a group. And we just take care of that right then and there. So all the folks that came to all 70 folks who were at our Philadelphia training are on a group list. So they can chat to each other. They can say, oh, Senator Casey is making an appearance here. Who wants to do this? So maybe think about that. For any more information, Paul Davis, who again is doing a training in Boston today and tomorrow and was unable to make it, you should still direct any questions about more information at him. His email address is p.davis@housingworks.org. And then finally, since this is a very brief presentation and there are a ton of moving parts, Paul does kind of the exact same training that I just did. Any questions you can that we don't get to, you can email. I also am open to getting text because text I answer a lot quicker than I do emails these days. I'll just give you my cell phone number right now. It's 347-834-1560. Again, it's 347-834-1560, so that if you don't get an answer from me by email at j.benjamin@housingworks.org, which is up on the screen right now, just send me a quick text, and I'll do the best that I can. So Terry, are there questions that we haven't answered?
I guess for me, I just want to give some closing comments before we end. Just a reminder, I mentioned it at the beginning, that the reason why we had this webinar today is because people with ME around the country are on Medicaid and Medicare and some form of the ACA for their health care. So we thought it was important to have this, not only to target those issues that impact our lives, but also just a basic skills building because the ME community's issues are very complicated. I also, again, want to remind people about the resources that are available on the ME Action website. We have several articles about bird dogging. We have an article about how to find out where your elected official is going to be. And then in closing, this is an idea that I came up with a couple of weeks ago about having kind of an ongoing activist webinar series, and would be very interested in hearing about what people would like for future topics. So if folks want to email me at tlwilder, it's WILDER, at mindspring.com. I would love to hear what topics you'd be interested in hearing about in the future.
So one thing that just came up on the chat is mentioning how people are doing teletown halls. This is one of the things that has made our trainings go 2 hours and sometimes 3 hours, is then talking about teletown halls, because that is a whole nother beast. And they're actually, I'm not aware of a set of best practices for teletown halls. I will say that for teletown halls, you want to get your question in super early. It depends. I think for teletown halls, because they're so big, you want to get a lot of people asking different questions. And I think the way that you do it is you have half the people ask a super vague and somewhat complimentary question, because people don't necessarily don't always allow they select the questions, right? And they're not going to put their boss on the spot. So in some teletown halls, they just have like, if you send in a vague question and it looks good for their boss, they'll say, all right, cool. Person X who asked some harmless question about saving the United States with healthcare, you're on. And then you can ask your very specific closed-ended question about protecting or improving the Affordable Care Act. And then sometimes they randomly select them, although I do think they do some screening. Sometimes they're less intentional and actually read the question aloud when it's not just somebody's lackeys doing all this stuff. I think with teletown halls, it's a whole new world. So I think that that it's I think you should just get a lot of people to attend the teletown hall, and you should just kind of flood the zone. Just get a lot of different people doing different things.
Great. Thank you so much, Jaron, for your time. I really, really appreciate you having this for us. It's super important for the ME community to hear presentations like this. Again, very grateful for you taking your Sunday out for us. So thanks again.
Hey, thank you. And thanks, everybody.
All right. Bye, everyone. Have a good rest of your holiday weekend.
Take care.
Thanks, Ben.
Thanks so much. Great to meet you, Jaron. Take care. So Terry, I think we'll, in addition to here, let me get the right. Hi, Mark.